Welcome, everybody. Thank you for joining us. I'm excited to get to have a talk today. This silver dollar is reminiscent to me of something that I have come to say to a lot of patients in my office, and that is, would you take the chance of your health being dictated by knowledge or tests that were equivalent to 50% accurate? So if I flip this coin and you called heads, for instance, we'd have a 50-50 chance of this coin landing as heads. And in that setting, if it's just something like, do you want chocolate ice cream or vanilla ice cream, that's not a big deal. But if it was really to say whether or not you were going to live or die from heart disease, I will tell you, I do not want the odds of flipping a coin. And unfortunately, in Western medicine today, one of the most, I almost would say, sacrosanct things that we do, but one of the very common things that everybody now knows what we're talking about when I say your cholesterol panel or a lipid panel. That batch of tests, that's about 5 tests, your total cholesterol, your triglycerides, your HDL, and your LDL cholesterol, and then that ratio. That little batch of lab tests we call the lipid panel has now become sort of the standard. Like if you go to your doctor or your internist for your annual exam and they order blood work for you, that panel is ordered for most people. And so when you then get your results back from the doctor and they tell you everything's okay, there are parameters. And the American Heart Association has done a nice job saying you should know your numbers and that your total cholesterol should be less than 200 and your LDL should be closer to 100 and you want your HDL as high as possible. We think of it as the H for healthy cholesterol. And so we've all, I think, gotten that message fairly well, any of us that are sort of trying to educate ourselves about our health. But there's more to the story, and that's what our talk is about today. I'm going to share my screen so that you can see my PowerPoint, and then we'll revert back to our visual of all of our faces here in a moment. Let's see if I can get it open. There we go. I'm going to share my screen. There we go. Okay. Let's see. I'm just moving my pictures of all of you so that I can see my slides. All right. So flip a coin, and how we can improve our healthcare heart odds are what I'm really covering today. And if we look at the United States today, we have traditional testing that is that lipid panel that really tells us whether or not that LDL-C, I'll tell you what that means in a moment, whether your LDL-C is elevated and whether your total cholesterol is elevated. That's what we would call traditional testing, a traditional lipid panel. The thing about it is that only 50% of people are identified as having a risk for a heart attack from that panel. So it really does not tell us the whole picture. It's as good as flipping a coin to use that test to dictate whether or not we have risk of a heart attack or a stroke. So when we look at the options of what we could do that would do better than 50%, I want to give you some insight into some things you can ask your doctor for or that you can do differently that would make a difference in your own risk or your own ability to be preventive. I'm going to move our pictures here just a moment. There we go. Sorry. So this slide is actually a picture of a blood vessel. It's kind of like a cartoon of a blood vessel. And you can see here at the very left side of your screen is a nice open, clear blood vessel. The wall looks smooth. There's no plaque buildup that's blocking that blood vessel. And as we move along in life, and in all honesty, we're now seeing that even in 10-year-olds, we start to see little bits of plaque buildup. And so this little yellow line is showing a cholesterol deposit or plaque buildup in the arteries. And as time passes, if we build more and more of a plaque buildup in our arteries, we tend to have a propensity or a risk for heart attack, because if that plaque ruptures, it can make a blockage on the inside of the heart arteries, or any artery for that matter. If that happens in the heart, we call it a heart attack. If it happens in the brain, we call it a stroke. But the mechanism is really the same. So one of the questions that we've had in medicine is, how could we do better at predicting who's going to have risk? And so when we test a traditional lipid panel, we're testing the blood to see how much circulating LDL cholesterol there is in that bloodstream. But I want to dig into that, because when we do that test, we come up with a number that is often really misleading to people. And many people will say to me, I've had a stent, and so everything's all taken care of and I feel so much better. And this is a description that I think is really helpful to realize, that if you do have a blockage in your artery and you've had a stent placed, so in the center, this little white rim is a stent, you've now made sure that you've sort of put a straw or a pipe inside that blood vessel so that this plaque can't rupture and burst into the opening of that blood vessel. But in this case, you can see how all of the other heart arteries have plaque in them. And in fact, this one here at the bottom looks terrible, like it could very much rupture or close off because of the amount of plaque in that artery. So if you have a stent placed, the one artery that has had the stent placed is going to do well. But we want to do things to know what your real risk is and what we can do to prevent risk from the other arteries actually blocking off. So this is just a reminder to me that a lot of times people will think that they've been, quote unquote, fixed by having one stent placed or one bypass or even a quadruple bypass. But if we haven't worked with every artery in the heart, we still have areas that could lose blood supply if we didn't reverse that course. Some of you may remember Tim Russert, who was a beloved person in the sports world in years past. And he actually sort of rocked the United States with his death, because he actually had an LDL that was 70. So when you go to your doctor and they tell you your LDL cholesterol, and if it's under 100, you're probably going to get a pat on your back. They're going to be excited that that level is 70 and not, say, 170, which is where we don't really want it. So his level was 70 shortly before his death. And one of the reasons that is such a tragedy is that there would have been other testing he could have had done that would have shown that he was at risk. And instead, he had sort of a false assurance that everything was okay. The way that this slide works, I want to show you this box that's yellow here on the slide. That's encompassing all the people who have an LDL cholesterol that's in the normal range. So this is everyone whose LDL cholesterol is 100 or whose LDL cholesterol is 90 or 80. So all of these people in the yellow box have a normal LDL cholesterol. And we call it LDL-C because it's the calculated cholesterol. If you go back to one of your lipid panels, you can go look it up. If you look in My Chart or you look in one of your portals that you can look your own information up online, or if you have a printout, you'll see on your LDL cholesterol test that you've gotten from your doctor, it'll have LDL-C or -calculated. And that just means that when they drew your blood, they pulled off all the other parts of the blood draw, and then they calculated how much was left and what it weighed, and that's your LDL-C. And so an LDL-C of 70 or 87 is considered pretty darn good. That's a nice low level of what we think is there of your LDL cholesterol. So what more can we do? Why do I say that's not enough? There's two tests that are really important to ask for. To me, the two that are the most important, and I'm saying this because it's what the literature has educated me to say. In other words, they're not just my random favorite. They're my favorite because they are the most predictive of whether or not a person's at risk for a heart attack or a stroke. And they're the one you see here in red. This LDL particle number is one of the numbers that's most important. And then the second number that's most important is this top number on this page, the small LDL particles. Now, what am I talking about when I talk about these particles? If you imagine that you had cholesterol, let's say that your LDL-C, your calculated LDL cholesterol was 87, and that's a really good number. The problem is we don't know from that number, by just weighing the cholesterol, we don't know how many pieces are made up, or that total is made up by. So it could be made up of 3,000 pieces, or it could be made up of 1,000 pieces. And so in this patient's case right here, this total number that's in red means that that total LDL-C that they had, which their level was 108, so LDL-C you can see is 108, it's made up of 1,679 pieces. And you'll notice over here that LDL-C is only normal if it's under 1,000. Other labs right now, the lab that I'm using most commonly has 1,100 as the cutoff for normal. But this level, if that LDL particle count is higher than about 1,100, we start to be concerned that it means that there's a number of particles in the body in that LDL calculated number, and it's the number of particles that is the most predictive value. If you know that that number is at 1,100 or lower, you know that you do not have increased risk of a heart attack or stroke. If that number is above 1,100, you do have increased risk, and it is definite. And I'll show you the correlation that'll help you understand why I've become absolutely convinced that that number is one of the most important numbers in medicine. The other thing about this small LDL particle number, sometimes as a physician, I have a lot of things that I think of as sort of the yellow flags, and it's almost like the small LDL particle is my big alert about a bunch of other things. It tells me how your pancreas is working. It tells me how your liver is working. It tells me how your blood sugar control has been going and whether or not you're insulin resistant just from looking at that number. So if your small particles of LDL are less than about 530, we think that's normal and you do not have insulin resistance, you do not have pancreatic dysfunction, and you don't have elevated risk from those small particles. But if they're high, like in this case being 1,000, there's a risk because this person almost certainly has insulin insensitivity, like they're pre-diabetic. And the other thing about this is that the small particles are the ones that sneak into those blood vessel walls and make plaque. The large particles don't. So when I have large particles of LDL cholesterol, I'm much less worried. But if I have a high level of small particles of LDL, then I'm actually really concerned and I get fairly aggressive. And I tell people this prescription for fiber that I'm giving you is just as important as if it was a Lipitor prescription. We're going to get these numbers down through some natural methods. So that LDL-P, which was that number that was 1,600 on the first value that I showed you, LDL-P is the most predictive for risk. And so in this graph, you want, if you wanted to live a long time, you'd want to be up in this side of the graph, up at the very top. And this is people who had a low LDL particle count and a low LDL calculated amount. So their LDL-C that their doctor had been doing for years and the number of particles were both low, and that's the best scenario. The worst scenario is where you have lots of particles of cholesterol, even if your LDL-C is low. So like Tim Russert would have been in this in that area, because this is actually someone who has numbers that make most traditional lab tests look normal to a doctor, but his particle count, which had never been tested, would have been high, causing a heart attack. This is another way to look at it. So if you like graphs, and I'll try to explain it because some of us don't like graphs, but if we look over 5 years of time, in this case, the scenario is that we want the lowest incidence. So we want to be down in this corner of this graph. We want the least heart attacks and strokes. And so what we can see is that over 5 years of time, people that have a low LDL-P, a low particle count, do the best. It honestly doesn't matter. Notice, it doesn't matter if they have low LDL-C or not low LDL-C. These two lines are still the lowest lines, and they're the people that had the lowest particle counts. So in many ways, I will tell you the reason I do this testing, this LDL particle testing on every patient I do cholesterol testing on now, is because I can't guess if you're going to be in the category where your LDL-C is low or high. I can't guess if that's predictive or not. And sometimes you can have a low LDL-C, like a 70 or an 87, but you can have high particle counts, and that really shows us that you're at the highest risk. One of the other tests someone was asking me about a little bit ago is an ultrasound of your neck to measure the actual plaque in the artery, and that's also a helpful predictor. So if you kind of think about this particle thing, it's almost as though you could have the same LDL-C. You could have an LDL-C, the traditional test that said 87 or 70, which would both be great numbers. But if it's broken into lots of big particles, there's less risk. If it's broken into lots of small particles, there's more risk. And many people will use a freeway example to say that if there's less traffic on the freeway, if everybody's in buses, there might still be lots of pieces of cholesterol, but they're all packaged into bigger transport mechanisms. And so the bigger particles of cholesterol, of LDL, are safer because they actually don't cross over as easily into the blood vessels to make plaque. So it's a less congested bloodstream when we have more big particles instead of lots of small particles. This is just to give you a frame of reference. This is interpreting a patient's results. And so in this case, this person had a level of LDLP, or particles, of 1,400, which is a borderline high level. And if it's below this somewhere close to 1,000 level, we think of it as normal, and below 1,000 is optimal. And then the small particles, the little pieces that can get into our blood vessels and cause plaque, we want well below 600. I usually use about 530 as our cutoff for normal. And you can see in this case, the person has really high levels of those tiny particles of cholesterol. So the sad but true state of affairs, I guess I would say, in the United States is that we spend so much more on things that don't really make us healthy than the things that do make us healthy. So if you think about the things that really do make us healthy, about 50% of the impact on our health is our healthy behavior. And if you look at lifestyle choices, which those of you that know me, and if you keep tuning into our weekly webinars, you'll know that we really spend a lot of time learning about healthy behaviors. And in fact, the focus in our office is how do you implement healthy behaviors? How do we make it practical so that people can eat well and move better and sleep better? Because really the things that do make us healthy are at least 50% in the category of healthy choices and healthy behaviors. Our environment has an impact and our genetics have an impact, but each maybe 20% or so. Really, it's our choices and our behaviors that make the biggest difference. And instead, where our expenditures go in this country are only 4% of our health expenditures are on healthy behaviors, and 88% of our expenditures are on medical services that don't necessarily make us healthy, and many times are reactive or sort of what I think of as Band-Aid medicine because they don't fix the underlying problem. And that's really what functional medicine is. Functional medicine is committed to really moving back towards putting our focus and the expenditure of our time and money on healthy behaviors and adjusting all of those behaviors to help our body heal, because the body has the capacity to really do phenomenal healing and come back to health if we give it the support and the ingredients and the choices by our healthy behavior choices each day. So if I look at keys to heart health, the one thing you will probably have gathered by what I've talked about with the particles is I would very strongly ask your physician for a particle test. And there are many people that will scoff at it. If they're scoffing at it, to me, that means they've just not become a student of it yet. They have not read the studies or the articles comparing it to the predictive value of other testing. And they are vastly available within the cardiology literature. So first off, ask for a particle test from your doctor. One way to sort of define what that test is sometimes called is NMR, which stands for nuclear magnetic resonance. They take the blood and they give it an MRI. And that's only done in 2 places in the US, but it can be sent from lots and lots of labs to those 2 places on the East Coast to look at the particles. And then when you have that particle count back, what we do in our office is we sit down and we do a personalized health plan. And usually the health plan has some combination of these things on this list. And notice this list will start to sound quite familiar because it's almost the same list at the end of every talk I give. And I say that because if you create heart health, you're going to create brain health. If you create gut health, you'll create heart health. They all are tied in together. And so realistically, the steps to really stabilize cholesterol and then start to lower it, because it is reversible. I've actually now seen the plaque counts in people's arteries decrease over time when we're using this protocol. And so what we dial in is how to help you stabilize blood sugar. And you can do that through lots of different dietary approaches. One of the ones that we're using more and more now, and it's being talked about more, is intermittent fasting. So you can work on blood sugar stability with small, low glycemic meals in a 5 or 6 time a day type pattern, or in an intermittent fasting type pattern, or in a ketogenic diet. All of those work for blood sugar stability. The other things that are really important for reversing cholesterol are exercise and sleep. Those two pieces are sort of nature's nurse. Our body works on regenerating health and repairing when we sleep, and exercise and movement is how we keep the heart muscle in its best shape and best ability to respond to anything in our lives as far as the stressful things we deal with or the day-to-day expectations of our life. Stress management on this list, I would say, might be the hardest piece of the puzzle, but I really encourage you to delve into what it takes for you to lower stress management or stress responses in your body. Simple things, and there's another presentation you can look up about stress management, but deep breathing, time out. I tell people you need to go put yourself in detention, and so that you let yourself decrease tension for 15 minutes a day, and that'll actually help you stay in a better state of regeneration for your health. The parts of the prescription, I guess I'd like to call it, for people who need to lower cholesterol, where I dial in really specific individual guidance, is around vitamin D, omega-3, and fiber. And it's not just eat more vegetables for most people. It's actually an amount of fiber that's a very specific kind that I want them to take, depending on what their needs are. So I actually enjoy doing this because it is such a rewarding place that you can see results by using this list to manage your heart health and to lower your cholesterol. I hope you will stay tuned each week as we do additional health topics. And certainly, please feel free to ask any questions as we go on, because we would like to help you at Exo Health. If you need the office phone number, again, for my office to make an appointment, and just know those appointments can be video appointments or in-person appointments. But that phone number is listed in the chat box, but it is 760-573-2761. And Kirsten at our front desk will be happy to take your information and help you understand the options for an appointment if you wish one of those. Let me come back to the non-PowerPoint view here so that we can do some questioning or talking. Thanks, everybody. At the moment, you're all on mute. Almost all of you are on mute. So if you want to ask a question, feel free to unmute yourself over in the bottom left corner of your screen if you have something you'd like to add or ask or talk about.